This presentation is on a research article titled Effect of Alternate Day Fasting on Weight Loss, Weight Maintenance, and Cardioprotection Among Metabolically Healthy Obese Adults, a randomized clinical trial. This study was conducted between October 1st, 2011 and January 15th, 2015 at the University of Illinois Chicago and published in JAMA International Medicine in July 2017, so less than 3 years ago. There is one disclosure that Dr. Verity, one of the researchers on the study, reported receiving an advance for a book titled The Every Other Day Diet, the diet that lets you eat all you want half the time and keep the weight off. There was no conflict in funding. The funding sources had no role in the design and conduct of the study, collection, management, analysis, and interpretation of the data, preparation, review, or approval of the manuscript, and the decision to submit the manuscript for publication. I found this article interesting because fad diets are always brought to the attention of dietitians, especially when seeing overweight or obese individuals who are looking for weight loss. This was a decent study. It had its limitations, which we will talk about later, but it was a decent study, and I was curious to see how this diet in particular compared to a typical diet we would normally advise for obese individuals, especially in terms of weight maintenance, as fad diets are notorious for their inability to sustain weight maintenance long term. So this is just an overview of the presentation. We'll discuss the background behind the study, study objectives, study design, participants, the interventions, outcome measures, results, strengths and limitations of the study, and conclusions and future applications. So a little background to this study. The first line of therapy typically prescribed to obese patients is a daily calorie restriction. However, many patients find it difficult to adhere to a conventional weight loss diet because food intake must be limited every day, or so the story goes. Adherence to this diet typically decreases after 1 month and continues to decline thereafter. So alternate day fasting was proposed as an alternative. It has had increasing popularity over the past decade. Over 1 million diet books were sold in the US and UK on alternate day fasting. And findings from short-term studies indicate that participants lose 3 to 7% body weight after 2 to 3 months and experience improvements in lipid profiles, blood pressure, and insulin sensitivity. However, to date, there were no long-term randomized clinical trials that have evaluated its efficacy or compared this regimen with a conventional weight loss diet, so that is what this study aimed to do. The objective of this study was to compare the effects of alternate day fasting versus daily calorie restriction on weight loss, weight maintenance, and risk indicators for cardiovascular disease. So for the study design, 100 participants were randomized to one of 3 groups for a total of 1 year. The first group was the alternate day fasting group. They received 25% of their energy needs on fasting days and 125% of their energy needs on feasting days. The second group was the daily calorie restriction group, who received 75% of their energy needs daily, and the third group was a control group who had no intervention at all. The study was 1 year. It started with a 1-month baseline phase in which the individuals consumed their usual diet, maintaining a stable weight. And then the action phase of the study started with a 6-month weight loss phase and a 6-month weight maintenance phase. All participants were instructed to not change their physical activity habits throughout the trial and maintain a sedentary lifestyle. The control group was instructed to maintain their weight throughout the trial, not change their eating or physical activity habits. They received no food or dietary counseling, but they did visit the research center at the same frequency as the intervention participants to provide outcome measurements. So who participated? Participants were recruited from the Chicago area by means of flyers placed around the University of Illinois Chicago, and they were screened via questionnaire, assessment of BMI, and a pregnancy test. Participants had to be within the ages of 18 and 65, have a BMI between 25 and 39.9, and have a sedentary lifestyle, which they defined as less than 60 minutes a week of light activity for 3 months prior to the study. Exclusion criteria included a history of cardiovascular disease or diabetes, both type 1 and type 2, use of medications that could affect study outcomes, unstable weight for 3 months prior to the study, perimenopause or irregular menstrual cycle, pregnancy, and current smokers. 100 participants were enrolled in the study. Most of the participants were women, with 86 of the 100 being women. Additionally, most of the participants were Black or white individuals, with only 2 Asian and 3 Hispanic individuals completing the study. The mean age of the participants was 44 years, but ranged from 18 to 64, and the mean BMI was 34. There was a high dropout rate in this study, with only 69 completing this study. The highest dropout rate was in the alternate day fasting group with 38%. The majority of the dropouts in this group were reported to be due to dissatisfaction with the diet. There was also a 29% dropout rate in the daily calorie restriction group and a 26% dropout rate in the control group. However, none of these dropouts in these groups were due to dissatisfaction with the diet. So moving on to the intervention of the study, the first phase was the weight loss phase, which was 6 months in length. The first 3 months, the participants were provided all their meals. Each meal followed the American Heart Association guidelines, with 30% calories from fat, 55% calories from carbohydrate, and 15% calories from protein. The second 3 months, their food was no longer provided. However, individuals met with a dietitian individually on a weekly basis. Baseline total energy expenditure was measured for all participants using doubly labeled water technique. The difference between these two intervention groups during the weight loss phase, the alternate day fasting group consumed 25% of their calorie needs as a lunch on their fasting days, and that was their only meal. On feasting days, they consumed 125% of their calorie needs, split between their 3 meals. The daily calorie restriction group consumed 75% of their calorie needs, split between their 3 meals daily. The second phase of the study was the weight maintenance phase, which was also 6 months in length. At the start of the 6-month maintenance phase, total daily energy expenditure was reassessed using doubly labeled water technique. During these 6 months, participants were instructed to maintain their body weight. Participants met individually with the dietitian monthly basis now instead of a weekly basis, and received cognitive behavioral strategies to prevent weight regain and personalized energy targets for weight maintenance. The differences between these two intervention groups in this phase is that the alternate day fasting group was consuming 50% of their calorie needs as a lunch as their only meal on fasting days, and 150% of their calorie needs split between 3 meals on their feasting days. So the schedule of the alternate day fasting diet remained the same, but now participants received an average of 100% of their calorie needs. And then the daily calorie restriction group received 100% of their calorie needs split between 3 meals daily. So moving on to the outcomes that were measured throughout the study. Change in body weight was measured monthly on a digital scale with participants wearing a hospital gown. Fat mass and lean mass were measured every 6 months in the fasted state using dual energy X-ray absorptiometry. Visceral fat mass was measured every 6 months using magnetic resonance imaging. Mean percentage energy restriction during the weight loss phase was calculated retrospectively by using the intake balance method, using doubly labeled water technique, and changes in body composition. Physical activity was recorded as steps per day and measured 7 consecutive days every 6 months using an activity monitor armband. Diet intake and adherence were assessed every 3 months with a 7-day food record. This was analyzed using Nutritionist Pro software, and adherence was defined as actual energy intake being within 200 calories of the prescribed daily goal. And lastly, blood samples were collected every 6 months following a 12-hour fast. In the alternate day fasting group, these samples were collected the morning after their feast day. Blood pressure, heart rate, total cholesterol, LDL and HDL cholesterols, triglycerides, fasting glucose, fasting insulin, C-reactive protein, and homocysteine concentrations were also measured at these times. For the results of the study, weight loss, weight maintenance or weight regain, and body composition showed no significant differences between the alternate day fasting group and the daily calorie restriction group at both months 6 and 12. As you can see in the graph below, there was significant weight loss in both groups during the weight loss phase and some weight regain in both groups during the weight maintenance phase. However, there were no statistically significant differences between the two intervention groups themselves, and you can see the data for the control group above marked with the white dots. The mean percentage energy restriction that was calculated over the course of the study showed that the alternate day fasting group restricted an average of 21% of their calories, and the daily calorie restriction group restricted an average of 24% of their calories. There was no statistical significant difference between the intervention groups or in comparison with the control group. In terms of dietary intake, the percentage of energy intake from fat, carbohydrate, and protein did not differ significantly over time in any of the groups, and physical activity did not change during the course of the trial in any group. So this is a little more interesting in the results of diet adherence. The alternate day fasting group was shown to exceed their energy goals on fasting days at months 3 and 6, and they fell below their energy goals on feasting days at months 3, 6, 9, and 12, while the daily calorie restriction group met their energy goals at months 3, 6, and 12, and fell below their energy goals at month 9. Not only does this show that there was greater diet adherence to the daily calorie restriction group compared to those in the alternate day fasting group, but it also begs the question that were members of the alternate day fasting group actually consuming a diet that was closer to the daily calorie restriction group rather than their own alternate day fasting diet? And was this why there were no statistically significant differences in weight loss and weight maintenance? And finally, we have the results on the cardiac biomarkers. So there was no significant differences between the alternate day fasting group and the daily calorie restriction group at month 6 or 12 for the following: for blood pressure, heart rate, fasting glucose, fasting insulin, C-reactive protein, homocysteine levels, triglycerides, or total cholesterol. The only statistically significant differences that were seen were with the HDL and LDL cholesterol levels. At month 6, HDL levels were significantly elevated in the alternate day fasting group in comparison with the daily calorie restriction group. However, at month 12, they no longer saw this difference. In terms of LDL levels, month 6 showed no significant differences, but month 12, LDL levels were significantly elevated in the alternate day fasting group compared to the daily calorie restriction group. So this begs the question if maybe fat sources were changed in the diet for the alternate day fasting group over the course of weight loss period to weight maintenance period. So now to discuss some of the strengths and limitations of this study. This was a pretty good study. It had a lot of strengths, but it also had a lot of weaknesses. But it's also important to keep in mind that this is the first study of its kind, and it provides a great starting point for further research. So some strengths include the fact that this study was the longest and largest trial of alternate day fasting done to date. The study design of randomized clinical trial was also a strength. I also liked how they investigated diet adherence to allow for better interpretation of the data. And I like how they investigated dietary intake, not just looking at calories and whether they met their calorie restrictions, but also including macronutrient distribution so that people can look into that further, see if that played a role. Some limitations include the fact that the control group was not really controlled. They were kind of thrown to the wolves, saying keep doing whatever you're doing without any guidance or investigation into what they were actually doing. The maintenance phase was also on the shorter side with 6 months. At least 12 months would be preferred. Calorie goals in the alternate day fasting group were not met, which may affect the data that was collected, as I had mentioned before. The alternate day fasting group continued to follow the diet schedule during the maintenance phase. I know these researchers were studying this as a long-term diet, but likely after weight loss is achieved, the individual will return to a normal diet schedule. So does this really show what weight maintenance would be like for someone trying this diet. There was also a high dropout rate. The population was mostly women and not very ethnically diverse. A large population of white and black individuals with only a few Asian and Hispanic individuals. Additionally, they investigated improvements in cardiac biomarkers, but studied metabolically healthy individuals whose biomarkers were within normal range at baseline. So this is likely why they saw no differences in this data. So some improvements I'd suggest. I would suggest that the control group receives calorie goals and diet advice for weight maintenance to receive the exact same intervention as the other intervention groups, but without the calorie restrictions, just to make sure they are controlled and the factors and the outcomes that are being measured and investigated can actually be compared to the control group. I'd also suggest that the food be provided for the full 6 months of the weight loss phase to ensure proper adherence to the alternate day fasting group. As I mentioned before, their calorie goals were not met. Food was only provided for the first 3 months, not the full 6 months. So if food was provided for the full 6 months, you would have proper adherence and maybe some better data. Additionally, the adult alternate day fasting group, I feel like the fasting diet should occur during the weight loss phase and then a normal diet schedule during the weight maintenance phase. This would likely mirror a more realistic, generalizable goal as patients are likely to not continue the diet after weight loss is achieved to see if this can be maintained long term without following that schedule. Additionally, better participant distribution with gender and ethnicity, and maybe studying a population of individuals who are at cardiovascular risk, such as people with metabolic syndrome, to see if the cardiac biomarkers do have differences in that population. And finally, for some conclusions and applications, the alternate day fasting diet did not produce a superior adherence, weight loss, weight maintenance, or improvement in cardiovascular risk compared with the daily calorie restriction. Additionally, the alternate day fasting diet may be less sustainable in the long term, with a higher dropout rate with this diet, with a significant portion attributed to the dissatisfaction with the diet, and worse adherence compared to the daily calorie restriction group. So overall, I feel more research needs to be done with some of the improvements I mentioned before I'd feel comfortable recommending this diet as an intervention for obese clients or patients who are looking for weight loss. Thank you so much for taking the time to listen to this presentation. Feel free to leave any comments below.